I'll do computer prematurely, but we'll have it.
Yes.
We'll have to edit out, I guess, because I'll be the one to get like midway through. I'm like, oh yeah, I was supposed to be recording. We do need Lance though. Okay, this is
Oh, should I admit?
Good afternoon, everyone. Welcome to the joint COP meeting this afternoon or morning if you're on the farther west from the East Coast. Welcome. We're going to be talking about the Bridge program today. As an icebreaker, we'd like you to type in the chat what was your favorite Halloween costume. So maybe you can say your name, which agency you work for, and as well as say what your favorite Halloween costume has been. And I'm going to pass it at this point over to Kristen Brown from the CDC.
Hello, everyone. I'm Kristen Brown, and I am one of the communities of practice organizers. The communities of practice are a way for the large learning community to seem just a bit smaller. So we have 3 communities of practice groups, each supported by 2 staff members from the Urban Institute. Juliana and I support the African American African Diaspora group. Lisa and Sophia support the Hispanic Latinx group. And Ian and Zara support the Asian American, Native Hawaiian, Pacific Islander, American Indian, Alaska Native group. And each month, the groups meet, members get to know each other. We discuss the work and our various projects that we're working on, as well as the current events related to vaccine equity. A member-led steering committee sets the agenda for each of these meetings and identifies areas for the larger group to discuss. And if you're interested in joining a COP, we made this an open house. We will drop the link in the chat at some point during the meeting. And with that, I will pass it to Alacia, who will introduce our guest speaker for today.
Hi, everyone. Welcome. So welcoming our speaker, Dr. Evelyn Twentyman. Dr. Twentyman serves as lead of CDC's Bridge Access Program and as senior advisor for vaccine strategy for CDC's Immunization Services Division. Dr. Twentyman previously served as lead of the ACIP work group for COVID-19 vaccines and as chief medical officer for the vaccine task force of CDC's COVID-19 response. She is dedicated to improving vaccine equity as a critical component of improving health equity nationwide. So, Dr. Twentyman, the floor is yours.
Thank you so much. And thanks everybody for being here today. I am so excited to meet you all and hear about your favorite Halloween costumes and about what you're doing to improve vaccine equity. I feel like you all practice where the rubber meets the road, and I really appreciate the work that you do and the dedication that you bring to it. I am going to spend a bit of time talking about our CDC Bridge Access Program, as well as attempting to hone in on and celebrate the critical role of partners in enhancing equitable access to updated COVID-19 vaccines through this program. I did want to say I am largely here to answer any questions you have about the program and to facilitate your connection to the program and the vaccines that it provides. And so feel free to that end to interrupt me anytime with questions and feel free to put any questions in the chat and just feel free to come off mute anytime. I'm just excited to be speaking with you all. So I want to start with what the Bridge Access Program is. So this is a temporary program to close this gap in access to COVID-19 vaccines. And the background here is that CDC is really committed to ensuring broad access to our updated COVID-19 vaccines, including after commercialization. As probably all of you on this call know, the COVID-19 vaccines were commercialized upon authorization of the new updated vaccines in September of 2023. So the U.S. federal program for the distribution of COVID-19 vaccines is done, and that has been replaced by the commercial marketplace. Now, that meant no change in access for most people, no change in access for most people, because most private insurers cover the vaccine, Medicaid covers vaccine, Medicare covers vaccine. And so this migration into the commercial marketplace of the COVID-19 vaccines didn't mean much for most people. However, there are about 25 to 30 million adults that we knew would lose access to free COVID-19 vaccination upon transition to the commercial marketplace, and other adults with health insurance plans that did not fully cover the cost of COVID-19 vaccination. So in order to uphold free access to COVID-19 vaccination, we worked at CDC to stand up this temporary bridge access program. So this program was announced in April of 2023 to maintain access to free vaccine for those 25 to 30 million Americans and the others without insurance that fully covers the cost. And we launched it in September 2023, specifically September 13th, 2023, the first day that the vaccines entered the marketplace. And this program exists to help adults 18 years of age and older without health insurance, and those with health insurance that does not fully cover COVID-19 vaccination costs, to access free vaccines through either public health infrastructure or participating retail pharmacies. And on the next slide, I'm going to dig a little further into these two halves of the Bridge Access Program. So this temporary solution is of two parts. So on one side, we have our public health infrastructure, and on the other side, we have our participating retail pharmacies. So on the public health side, we've got our longstanding stalwart supporters of vaccine distribution for those that need it most. So this side of the program leverages the existing public health safety net. So that's state and local health departments, that's other 317 enrollees, that's HRSA supported health centers. The way this side of the program works is that CDC has procured and is distributing all of that vaccine on the public health side. And then on the retail pharmacy side, this is kind of an innovative public-private partnership. On this side, participating retail pharmacies are contracted to provide free COVID-19 vaccination. And on this side of the program, those vaccines are donated by the vaccine manufacturers through a reimbursement model. In other words, once a pharmacy administers a vaccine, they tell the manufacturer that they did so, and the cost of that vaccine is reimbursed. And we at CDC cover the administration costs here. And we've designed the program to be about 50-50 across these two, and that's because we know that if we designed the program this way, we would maximize proximity to free COVID-19 vaccination for uninsured adults. So we did these geographic analyses based on census data and laid out this program in these multiple parts across the United States to really maximize access. I am happy to say, to that end, where we are right now is that about 81% of uninsured adults have a bridge access program site within 5 miles. And we're still expanding we're still expanding the total footprint of the program by continuing to recruit independent small pharmacies in rural areas under the eTrue North umbrella on the retail chain pharmacy side. And in case anyone else is curious about what the remaining retail chain pharmacies are, that's CVS and Walgreens. So every CVS, every Walgreens storefront, and then the small independent pharmacies that are coming online through eTrue North are participating in this program alongside our public health infrastructure. Now, I'm going to pause here and warn everybody that this is a temporary program, and say again that it's a limited program. And I don't mean to downplay the importance of the program. I rather mean to warn everybody that this is not the long-term solution. This bridge access program will end by December of 2024. And it's limited in that it is only COVID-19 vaccines. And as I'm sure everyone on this call knows, there are other vaccines that adults are recommended to receive, and those are not included in this program. This is a temporary limited program, which we hope is going to serve as a bridge to a longer term, more comprehensive, sustainable solution. And that could come in the form of a Vaccines for Adults program that could provide comprehensive access to all adults who need vaccine, who do not have insurance to pay for the vaccine, that might last for the long term instead of this short-term bridge access program. That, if you're curious, the Vaccines for Adults program has been approved in the FY24 presidential budget, but it has not yet been enacted into law by Congress. Now, let's talk about the role, the critical role of partners in implementing this program. So we've got really important partners here. So I've already spoken about the jurisdictions and the pharmacies a bit. To dig into the HRSA supported health centers a bit, they come under that public health infrastructure side and are these like long-standing sources of trust in healthcare and access in the community, and they are part of that public health infrastructure as well. And then other funded partners like PAVE partners are really filling a critical role as well. And let me dig into that a little bit more, especially because of some of the folks on this call and what you all are doing to expand access to free COVID-19 vaccine. So CDC funded partners like under PAVE, under related initiatives, can do a couple things to enhance access to free COVID-19 vaccination through the Bridge Access Program. So one thing they can do is host community outreach events to spread awareness of the Bridge Access Program. Another thing that they can do is work within communities as trusted messengers of the Bridge, partner with providers and other Bridge program partners to hold vaccine clinics, and or develop educational materials or adapt the educational materials that I'll show you in a minute for use in the communities that you serve. And before I move on here, I want to underscore how critical the partners are here. This is what we saw in the pandemic. It is not enough to shout about availability of COVID-19 vaccine from the rooftops. It's not even enough to do that in a more sophisticated way, like through ad campaigns and social media campaigns. Those are all good. Those are all critical, but they're not necessarily going to get to all the populations that we need to reach with COVID-19 vaccines. And that's why the partnership of you all on this call is so critical to actually getting this vaccine where it's needed most. We know that partners are in many ways the bedrock of this program, and we really appreciate your support in messaging and improving access and getting these free COVID-19 vaccines out there to people. Now, what are we offering to help with this effort of getting out there to people? I mentioned we have some resources to share that you could adapt for the communities that you serve if you find them useful. And so I want to review some of those now. Then I'm going to take a second to dive into how to connect with pharmacies toward pop-up vaccine clinics in case anyone is interested in that attempt. That's of course not the only way you can increase access to COVID-19 vaccines, but I am going to review that here because I know questions have arisen. So we've got a lot of upcoming national media to promote the Bridge Access Program through both English and Spanish messaging on multiple platforms to encourage adults without health insurance that covers all COVID-19 vaccine costs to go ahead and get vaccinated at a Bridge Access Program site. So one, we have paid ads on Facebook and Instagram. These ads will encourage eligible adults to visit vaccines.gov to find a participating provider. And you know, the reason we did this is that 60 to 70% of Americans have a Facebook account. These ads too will be in both English and Spanish, so we're really hoping to maximize our reach here. We are doing what's called a MAT release, like a release of paper media, as well as digital radio ads to improve reach to priority populations. These messages will be in both English and Spanish. And these messages are targeted to fairly specific geographic areas with high rates of uninsured populations, and really are hoping to prioritize viewing of these ads by Black and Hispanic audiences. We really want to get out there in the most equitable way possible. And then we are also, it's kind of hard to say, we are also using organic social media. So we have multiple posts coming on CDC social media channels. In fact, there was a video posted last night, and we're hoping to use these to continue to reach large audiences. And we've created a toolkit for partners, so a toolkit for you. This is available on the Bridge Access Program website. It includes key messages, it includes a sample newsletter, and then to dig into a little bit more of the resources and promotional materials. So it does include frequently asked questions. It includes several one-pagers now, actually, on the CDC's Bridge Access Program and how it works and where you or those you serve can find a vaccine. And it includes social media messages that you can adapt and share for use in the populations that you serve. So you might be wondering what other things you can do today to spread the word about the program. And let me pause a minute again and say, I know that a lot of you on this call are already spreading the word about the program. So I'd like to add to this title, what else can I do today to spread the word about this program? So one is to just continue the important work you already do to support vaccine equity, and thank you for that work. Another is to share and comment on social media about the program, to start conversations within your community about the program. I'm going to pause here to say one of the projects I'm super excited about is one in LA County that uses conversations with people experiencing homelessness to connect people experiencing homelessness to free COVID-19 vaccines through mobile vaccination clinics. Those conversations at the community level cannot be replaced by anything else. So thank you for your support of those.
And ladies and gentlemen, as the captain stated, all our issues have been taken care of, and it is now almost time to push back from the.
Oh, I'm so sorry. I did not understand that. If that was a question.
I think that was probably someone who went off mute.
Okay. Okay, no worries. Another thing that you can do is just read through this communications toolkit for partners, see if anything is useful for you, and check out other available resources, and then look through the Bridge Access Program website. We're continuing to update it as more resources become available, and we hope you find something there that is useful to you. Now I want to dig into a bit how you can reach out to Bridge Access Program sites. So one question we've gotten a lot is, okay, if I've got the strong connection to my community and I know how I can either get members of my community to a Bridge Access Program site, or I want to organize a pop-up clinic, how do I do that? And so that slide is this one right here. So one, you can contact your state or jurisdictional immunization program to learn more about opportunities to coordinate with public health sites. And you can find that complete list of every single jurisdictional immunization program along with their contact at this site that I've put right here. You can also work through two of our pharmacy partners, and those two are eTrue North and Walgreens. Those partners both have the ability in their contracts with us to complete these mobile vaccine clinics and to get reimbursed for the vaccines that they provide at that local level where they're needed. So the way that you explore those opportunities is one, you can email eTrue North at this email address right here. That's community BAP, as in Community Bridge Access Program, at etruenorth.com. Or you can complete an interest form with Walgreens to explore coordinating pop-up vaccine clinics with Walgreens. And that link is here. It's also known as wagsoutreach.com. And then with any other additional questions, especially if you don't end up with time for them here, you can reach out to our inquiry box at Policy ISD Bridge at cdc.gov. That's Policy Immunization Services Division Bridge at cdc.gov. And so that is what I brought to sort of explain the basics of the program to you. But of course, there's a lot more that we could talk about. I'm going to look first in the chat for questions, and then, oh, it looks like all Halloween costumes. And these Halloween costumes are awesome. If you've never had a Halloween costume, I hope you get one fun this year. So let me stop and ask, can you repost the email address? Yeah, absolutely. In fact, I'll just copy these into the chat right now. Why not? Community BAP at etruenorth.com. Oops. And then the other is wagsoutreach.com. And that is not an email address. That's a site that you go to visit to complete a form. Okay. So what other questions do you all have? I should have put, sorry.
Amanda has a question.
Oh, great, Amanda. And I'm going to put the Bridge Access Program box in the chat while you ask. Please go ahead, Amanda.
Hi, yes, thank you. My name is Amanda from La Clínica de la Raza here in Oakland, California. So one thing that really struck my interest was vaccine pop-ups, mobile pop-ups, and we have been doing that. Many, I believe this will be our 12th one that we've been trying to launch at an Oakland Coliseum flea market. One thing I have been noticing, though, in efforts to make more opportunities to vaccinate is that, and I'm not sure if this is the Alameda County issue, but from trying to coordinate mobile pop-ups, there seems to be very limited amount of free vaccines that can be offered. Now, I'm not sure if that is just a county issue, a state issue, or nationwide issue, but I'm just trying to get an idea of how would that work? Because, for example, we're trying to coordinate another vaccine pop-up, but we can only give out 10 Pfizer vaccines and only 10 Moderna. So that's not enough in my mind to provide equitable access to those who don't have insurance or are underinsured. Thank you.
So can I just clarify, you reached out to Walgreens, or I'm sorry, who did you reach out to that said you could only get 10 Pfizer and 10 Moderna?
Yes, we partner up with another clinic here in Alameda County. They're called La Familia. And I'm not sure how they access their vaccines, but they did bring it to my attention that it was from Alameda County, that I believe Alameda County only got a certain amount, and I don't want to misquote, but to my knowledge, what I can recall is 7,000 free vaccines just for the Bridge program.
Okay, I think I understand what's happening here. Okay, so there's a difference between the public health infrastructure and what Alameda County got from the Bridge program and the vaccines available through pharmacies, which is how pop-up clinics occur. So the public health infrastructure vaccines are a little more limited because their distribution was based on the number of uninsured adults in each jurisdiction. And then furthermore, those jurisdiction immunization programs distribute those to best reach uninsured adults. But in other words, there's only so much vaccine that goes out and then gets distributed. And there are going to be finite quantities. Now, I do know that there is a group in Alameda County that is successfully using those vaccines through mobile pop-up sites. I spoke with him yesterday, Dr. Londono. Maybe I can find a way to connect you all after this call. But the pharmacy vaccines are a little bit different because there's no like preset amount. The donations by manufacturers to pharmacies happen on a reimbursement model, meaning that Walgreens, if they had the capacity, could set up a big pop-up clinic, and every vaccine that they delivered to an uninsured adult through the Bridge program, they would file for reimbursement with the vaccine manufacturer, and they would ask for reimbursement from us for the administration of that vaccine. So there should not be any sort of artificial limit on those, even though I get there's going to always be transient limits on the public health infrastructure vaccine, because there's sort of this preset amount. Whereas on the reimbursement model side, there is not a preset amount. Did that all make sense?
Yes, thank you. That definitely brought some clarity and also some more support on, how we can go and continue to distribute free vaccines. I think maybe what we could potentially try to lean into now is doing the working with like Walgreens or CVS, that reimbursement method. I didn't know that process, so that kind of gives us a little more clarity on better avenues in providing free vaccines. So thank you, appreciate that. And also, I don't know, Evelyn, would you be able to connect me with the Alameda County?
Yeah. What I'm going to have to do that, well, I hope so. Let me not say yeah so confidently as though I can accomplish anything. But what I'm going to do is contact the organizer of that discussion yesterday, where he described what his Alameda County-based project is doing with Bridge Access Program vaccine, get his contact info from them, and then connect them to you, which means I think you're going to have to give your contact info to Kristen Brown or put it in the chat or something.
That's exactly right. That's the right thing to do.
So that we can get everyone connected. Yeah.
So there are two more, sorry, I have been off screen. I didn't realize that. There's sort of two different questions in the chat that I think are useful. Some folks are saying that they've heard that some of the CVS facilities were not aware of the bridge program, and whether, the question is whether or not you will be planning to do more outreach on that front. And then another one, which I guess is sort of a different side of an access problem, has to do with FQHCs not being listed on the vaccines.gov. So if you could speak to each of those, that'd be great.
All these. So CVS. Okay, so CVS, Walgreens, and Eat Your North are all in contracts with CDC to provide free COVID-19 vaccination to eligible adults. In other words, they are legally bound to know about this program. I feel a little bit harsh when I'm saying that, but we have heard some things. So what I would like to invite you to do is, if you hear from one of your constituents or you yourself have the experience of a CVS store telling you they're not participating in the bridge program, or they don't know what you're talking about, or no, we don't provide vaccines for uninsured adults, please do seriously reach out to us at this email address, policyisdbridge@cdc.gov. And if there's any way you can include the store number, or at least its location, that would be very helpful to us as we provide feedback. I will offer that we heard, I would say there was confusion across all participating pharmacies in the first week or so, which I think all of us on this call, if we're all here and we've all been in public health, we know that happens. Transitions are hard. But at this point, we would really like to see that confusion going away across all sites. And so please do write us if you are seeing that. We are in frequent discussion with each of our retail pharmacy partners, but we definitely want to hear about it if you or your constituents are unable to get a vaccine at one of these locations. I do want to make a subtle comment, though, since we do have the time. One of the issues that I heard about yesterday was actually a point of confusion about pop-up clinics. So you'll see state and jurisdictional and Eat Your North and Walgreens here, and you'll see CVS is not on this slide because I intended this slide to speak about organizing pop-up clinics. Pop-up clinics are not in CVS's contract, so they're not going to be necessarily doing pop-up clinics. They can get reimbursed for vaccines there anyway, but they don't have any sort of special incentive to do pop-up clinics, unlike Eat Your North and Walgreens. So please do go ahead and reach out to them. And if CVS is telling you they don't do pop-up clinics, that is not a contract violation. So you'd want to reach out to others for the pop-up clinic questions. Okay, and then let me speak to, I'm sorry, will you remind me of the other question?
Yeah, the one question was about it seems like a bunch of some of the FQHCs are not showing up on the vaccine.com clinic, and a related question that came up after that is whether or not the FQHCs are being reimbursed for administering the vaccines.
Okay, yeah, let me speak to both of those. Okay, so vaccines.gov, let's talk about that first. That is a really interesting collaboration between a lot of parties. CDC provides technical assistance there, and we've been working really hard to build the capacity of vaccines.gov to onboard new providers, because with the standing down of the public health emergency, the ability of new vaccine providers to be listed on vaccines.gov appears to have been eliminated. And that's not great, because there are FQHCs, otherwise known as HRSA supported health centers, that are only just now able to provide free COVID-19 vaccines. And there are new clinics, and there are reasons that these clinics wouldn't have been registered previously with vaccines.gov and need to be registered now. And right now that capacity does not exist. So when we first messaged about this program, we included a lot of messaging about go to vaccines.gov, go to vaccines.gov, go to vaccines.gov. We still do say that for sure. Vaccines.gov is still a really valuable resource, I think, for the individual patient level, because all the CVSs, all the Walgreens, most of the eTrue Norths are now listed there. However, not all FQHCs are up there yet. Not all public health sites in general are there yet. That site in particular has been pretty challenging to work out with vaccines.gov. And so I just want to acknowledge that that is not complete yet. And so there is more to come there. Now, administration costs for vaccines. So the way, now we're going to dig into details. Okay. So on the public health infrastructure side, there are 317 enrollees and state and local health departments, and there are HRSA supported health centers. Distribution of all COVID-19 vaccine went through the state or jurisdictional immunization programs to all of these public health infrastructure sites. FQHCs and other HRSA supported health centers receive at least 25% of those vaccine allocations. The remaining 75% either goes also to FQHCs or to state and local health departments and or to other 317 enrollees as designated by the state or jurisdiction immunization program. However, the cost of administration, the way administration costs are reimbursed, really varies. And it varies by immunization, jurisdiction, and by HRSA supported health center. And this is because states and jurisdictions were able to ask in their supplemental awards for participation in the Bridge Access Program for reimbursement for administration. Some of them did, some of them did not, and they asked for slightly varied amounts. HRSA received a block of support in the form of $81 million to provide the HRSA Bridge Access Program funding. Sorry, I believe they call it the HRSA Bridge funding, not access. The HRSA Bridge funding. This funding can go to support vaccine administration, or it can go to support other things. HRSA's Bridge funding is slightly broader than CDC's Bridge funding, because while CDC's Bridge Access Program covers only COVID-19 vaccination and cost of administration, regardless of arm of the program, HRSA can also cover COVID-19 treatments, COVID-19 testing, staffing related to COVID-19 treatments, testing, vaccination, outreach related to COVID-19 treatment or testing or vaccination. But that's how that model works. So administration costs, if they're being covered, are being covered through that HRSA bridge funding. Sometimes jurisdictional awardees are also receiving administration reimbursement, and sometimes not, depending on what their jurisdiction immunization program applied for. I hope that helps answer the question.
Okay, we have, so there are two questions that seem very specific, but since we don't have any broader questions, I think we'll start with Heather and then go to Lana and have each of, and you can answer each of them.
Okay, you have a question about how an insurance company is categorizing due to these rules. Okay, let's talk about insurance coverage of COVID-19 vaccination. So, sorry, water, just a second. The Affordable Care Act requires that payers cover the costs of ACIP recommended vaccinations fully without cost to patient. However, as you may know, there were several plans at the time of the passage of the Affordable Care Act that were allowed to continue requiring a copay or some other form of offset to patient, offset of cost to patient. Those are the patients that, for the purposes of the Bridge Access Program, we call underinsured. So we often speak to the Bridge Access Program serving uninsured and underinsured adults. And what we mean by underinsured is adults whose plan does not fully cover the cost of COVID-19 vaccination. All payers are required to cover COVID-19 vaccination as of right now. In fact, as of September 13th. At the beginning of administration of the updated COVID-19 vaccines, we did see a lot of confusion about that. There were questions about, like, don't insurance programs have a year to cover vaccines? And the answer is all no. They were required to cover COVID-19 vaccines on day one. And that is because these have been recommended since January of 2021. They are on CDC's schedule of recommended vaccines. So, and furthermore, I'll just add this too, CMS issued a letter to payers in July advising all payers to prepare to reimburse COVID-19 vaccination, just reinforcing that, guys, you got to pay for COVID-19 vaccination. So I hope that helps answer questions about insurance coverage. I will furthermore say, though, that there has been some confusion over whether in versus out of network rules apply to COVID-19 vaccines, and then what does that mean for the Bridge Access Program. So now that we're back in the commercial marketplace, unfortunately, all these in versus out of network coverage rules do apply to COVID-19 vaccines, meaning there are insurance companies that will only reimburse a patient for vaccination at certain sites or at certain providers. And the Bridge Access Program does cover underinsured patients, but only in the setting of vaccination at in-network providers. In other words, it is not meant, the Bridge Access Program is not meant to cover costs incurred as a result of vaccination out of network. So a classic example that everyone gets sort of immediately, and so I share it a lot, is Kaiser Permanente. A Kaiser Permanente patient, if they were to go to Walgreens, would be told, you do not have coverage here. You are out of network here. You can either choose to be vaccinated here and pay out of pocket, or you can go to Kaiser Permanente. That patient could not be covered by the Bridge program. The Bridge program is really meant to serve patients without insurance and patients who don't have adequate insurance coverage when in network. And so I hope that helps clarify that. That was a deep dive into insurance, but I hope it was helpful.
Can I give you a little bit of detail on this one? Just that on this particular one, they've determined that they're putting COVID into their major medical category. And they're saying that, of course, you know, her physician is the only one she can get the vaccination from, but her physician is not carrying the vaccine.
Yeah, that's really frustrating. If you wouldn't mind emailing the plan to that bridge ISD policy at cdc.gov, like the name of the plan, we are going to have a conversation with some payers as well. And the reason that is one example of one reason that we're going to be talking with payers and with CMS and with HHS.
Okay.
Another closely related reason, in case anyone has a story about this, because unfortunately I've heard several. There are insurance plans who are claiming to provide coverage for COVID-19 vaccines and passing 100% of costs to patients. We do not feel that comprises coverage of the vaccine, as is required by the Affordable Care Act. So we are going to be engaging in a series of conversations about this, but please do email us with that particular case. Thank you. Regarding borrowing bridge access vaccine doses, some providers are procuring adult doses privately, but it is taking more time. Can providers borrow from bridge access and pay back? I'm glad you asked this question. This is actually a pretty common practice in vaccines for children's program, which I think is where this question arises. We don't have a mechanism for that in the bridge program. So that was not written into the provider contracts for the bridge access program. So that borrowing mechanism that exists in VFC does not exist in the bridge access program, unfortunately. And again, this would only be on the public health side, right? Because on the private side, on the retail pharmacy side, those donations are happening through a reimbursement model. So there's either no such thing as borrowing or every single bridge access dose is borrowed, depending on how you look at it. But all donation happens through reimbursement on that side.
Are there other questions from folks or other challenges that you're having this is a great opportunity to raise them up to somebody who could potentially do something about them? But that's a great opportunity for you all.
I had a question regarding I work with high school girls and we're having issues having them volunteer at pop-ups and stuff because of age restrictions. A lot of them are 15, 16, and 17 years old, but now we're hearing pushback that you have to be 18 to participate in any of those. So I don't know if you have any guidance on that.
We at CDC would not want to override any rules of any of these participating pharmacies or of the jurisdictions in which they sit. So I'm going to defer to the pharmacies offering pop-up vaccines and or the jurisdiction, depending on where the restriction is coming from. Younger people, I will say, we have found absolutely instrumental in communication, though. Especially if your population is connected to social media, and I'm not saying they are, but if they are, oh my goodness, we've had some junior fellows do some amazing communications on social media and do some really cool digital outreach. Obviously, I'm sitting here brainstorming, which is probably not appropriate. Let me just say we defer to the rules of the bodies governing these pop-up clinics. However, there may be other ways to volunteer, especially for like these young, brilliant girls.
Yeah, we have them do posters and flyers and TikToks and all of that stuff. It's just that's only part of it. Where before, earlier on in the pandemic and stuff, they were able to participate. Now that the emergency is less, we're seeing pushback because of their age.
The public health emergency did, of note, change a lot of rules on service provision for many states. So I'm not necessarily surprised, but again, defer to those jurisdictions.
Thank you.
Thank you.
Okay,
And thanks for setting up the pop-up clinics. That's awesome.
we have another question. Does True North have a presence in Puerto Rico? And I have another question, since actually I've never heard of True North, so I'm curious. I might not be the only one, so if you could talk about what that is, that would be great. I may
Sure.
just be naive, but
So the question about whether True North has a presence in Puerto Rico is a great one, and I'm embarrassed to say I don't know. And I talk to them at least once a week. I last exchanged emails about an hour ago, so I will ask. And I will get back to you on that. I want to comment on True North though. So True North is what we call a pharmacy aggregator, and sometimes we have called it an umbrella pharmacy. And the idea is that, well, let me tell you the motivation first. Our motivation in working through True North was to get to rural areas, to expand the reach of the Bridge Access Program into areas it would not otherwise be. There are many areas in the United States where, okay, let me back up again. CVS and Walgreens are very common sites. There are many state and local health departments. There are many 317 enrollees. I'll start there. We're at a good starting point. There are areas in the US, particularly rural areas, that do not have a high density of any of these. Not just state and local health departments, but nor do they have CVS or Walgreens. What we saw is if we worked through a pharmacy aggregator, we could work with those little independent pharmacies that these areas much more often had. And so True North is providing us with a way of reaching all of those tiny, sometimes we call them mom and pop pharmacies, and really expanding our footprint, particularly into rural areas. And how this works, if you're curious on the mechanics, True North is the pharmacy with whom we have a contract, and then all of these smaller pharmacies, and right now I believe there are 4,900 of them. That might not be correct. There are more than 4,000 of them, are subcontractors to True North. And so that's how we are able to expand the reach of the Bridge Access Program into these rural areas. Okay, so I see somebody's having a hard time logging into Walgreens. Let me reach out to them and ask what that's about. I haven't heard that before, so let me find out.
And then there was another question about the difference for BAP in regards to Native American IHS patients and whether they're insured or not.
So there are several ways for, how do I say this precisely? Okay, there are several ways for populations served by IHS facilities to have access to Bridge Access Program COVID-19 vaccination. And those are the following. So state or jurisdictional programs can designate IHS facilities for receipt of Bridge Access Program doses. That's one way. So that's the public health infrastructure way. Then separately, and by the way, now I'm like stepping just to the side of IHS, technically speaking, and I'll explain why. There are tribes that purchase their own vaccine privately, meaning not with IHS dollars. And that's what I mean by stepping to the side of IHS slightly. Some of these tribes are served by IHS in other ways, but not in the realm of vaccination. For those tribes that purchase their own vaccine, we are aware that True North is reaching out to them to see if they would like to come under the True North umbrella and have those vaccines that they administer reimbursed by the manufacturers with administration costs covered by CDC. So there are a few ways that that can happen. Oh, and then lastly, let me just say, any person who is a member of a tribe who does not have insurance can either get a vaccine through the Bridge Access Program if they're an adult, Or if they're a child, I just wanted to add to all, by mandate, all children who are members of federally recognized tribes have access to vaccines for children, vaccine doses. So, and that in that case, it's actually regardless of insurance. That is by federal law. So those are some ways that populations served in this capacity can get access to free COVID-19 vaccine. Mary Catherine Jones, that's a good idea of a graphic. That's a really good idea. I will pass that on to our colleagues.
We can see if we can do that too, as well. You know, working with you all, and then
That would be great.
yeah, we'll have to, I think we'll have to have a better understanding of the borrowing issue, but you know, we can work with some folks. But there's a second part to her question too. So
Thank
Okay.
you. Could you also address the second part of that question about if there's going to be any funding that you see coming down the line that organizations that are able to provide vaccines would be able to get some funding to purchase those?
I don't know of any. Are you if you're a 317 provider, you could potentially go through the state immunization program or jurisdiction immunization program. And if you're a vaccine provider and want to assume the risk of purchasing vaccines, there would be nothing that would stop you from going under the eTrue North umbrella. You do, by the way, you do have to be a pre-existing vaccine provider to participate under eTrue North. In other words,
and in our case, we're a charitable pharmacy, and we are one of thousands of free and charitable clinics and pharmacies across the US that are community-based, but not federally funded as FQHCs. And so we have the medical personnel, and many of us do purchase and provide vaccines to the uninsured. The problem is that, you know, we don't have funding to purchase vaccines, and with our the CDC Foundation grant we currently have, of course, you cannot use that to provide direct medical services. So I was just wondering if in the future there might be some mechanisms that are available to allow community-based organizations like ours that do deliver healthcare to people who are uninsured to purchase vaccines, keeping in mind that it's not just COVID-19, but at some point it would be great to do routine adult vaccinations as well.
yes, amen to that. Wouldn't it be great? Hang on, I'm going to pause and get on my VFA soapbox one more time. Okay, this is a very limited program. COVID-19 vaccines are not the only vaccines that adults need. There's flu, there's pneumonia, there's shingles. For some adults, there's RSV. For many adults, Hep B. Like there are many vaccines that are recommended for adults, and we are providing only one. And the funding and number of doses available in this program is not unlimited. It is not nearly the size of the federal distribution program that preceded us, not even close. We really do need a sustainable and long-term solution. I'm really glad that we've set this program up. I know that we've seen more than 300,000 doses go into arms of adults who are uninsured thus far since September 13th.
that's great.
On the pharmacy side, we've seen more than 250,000 orders on the public health side. Our doses administered data is going to come later from the public health side, but we know that the program is out there and working. But it's not the complete solution. And thank you for offering this example. I love talking with people that are actually providing services in communities because it helps me think of all the kind of mechanisms that are actually potentially available out there and what we could do on like a redesign or what to think about in design of a VFA should that ever be approved. Courtney, I see your comment that for 5 months you didn't have vaccines for your uninsured adult immigrants. Do you understand when you say it's limited? Yeah. This lets me make one other point that I wanted to make, and I don't think I made in this particular slide deck. The Bridge Access Program does not have rules of citizenship for eligibility, does not have rules of residency for eligibility, does not have rules for documentation in general for eligibility. The burden of proof for lack of health insurance we have put on the health system, not on the patient. So the patient can be asked when they come in for a vaccination, do you have health insurance? But they don't need to prove that they don't have health insurance. They don't need to be a US citizen, much less prove anything of the sort. And so I just wanted to say that the intent here is to provide access for everyone that needs it, to the extent that we are able, with limited doses and limited funding. We're going to do the very best we can because everyone deserves primary care.
I have a question. I'm going to take my question moderator's discretion and ask. But are the CVS and the Walgreens and the other sort of public health side, do they have access to Novavax as well as Moderna and Pfizer mRNA vaccines?
Oh, that's a good question. So of the retail pharmacy sites, only CVS is going to carry Novavax. Walgreens, by the way, this is not specific to Bridge. Walgreens is not carrying Novavax at all, whether in Bridge Access Program or otherwise. Novavax is available for ordering in public health infrastructure. So 317 enrollees, HRSA supported health centers, state and local health departments can all get Novavax as part of their vaccine doses. Now, True North is a little bit complicated because, as I mentioned, there are more than 4,000 pharmacies involved. So I can't say with confidence, how many of those also carry Novavax. But True North was not able to negotiate an agreement with Novavax. So Bridge Access Program doses available through True North subcontracted pharmacies would be Pfizer and Moderna.
Okay. All right. Well, I want to say a couple of things. I know there were some questions in the chat. Thanks for answering that. About the slides and the recording. Those will be posted on the PAVE website later, unless one of my colleagues tells me that I'm not speaking correctly. I think that's will be happening the next couple of days. But mostly, I want to thank Dr. Twentyman for this is a great conversation, and it's been something we've wanted to have for a long time, and I know everyone was like right there with you, and so thank you so much for sharing all the good work that you all are doing. I know it's a hard road out there, and I also just want to appreciate that you've been interested in hearing places where it doesn't work. So thank you. I can't thank you enough for spending the time with us. This has been terrific.
Well, thank you so much to everyone on this call, everyone here, for your amazing work. And thank you for the time to come and talk with you about the Bridge Access Program. And seriously, thank you for telling us about where it doesn't work and what's not working and what you're hearing and what the people you serve are hearing. All of this is just really critical information for us. So thank you so much for your leadership and your dedication and your support and your advice and your partnership. We cannot thank you enough.
All right. Well, we all have work to do, so enjoy the rest of your day. I gave you a minute back. Hope you can use it to have a nice smile or something. Take care, everybody.
Thank you so much.